Hey everyone, it's Taylor from Rant. We're getting ready to do our 2-day canine medical operator program, which is our 16-hour course that is designed for TAC medics, paramedics, handlers, EMT, basically anybody that can find themselves involved with a potentially injured police canine. We cover everything from the assessment to basic managing to doing some pretty advanced procedures. And when we're getting everything ready, I figured, you know what, this would be a good time to do a video on bloat, because bloat is a serious condition that affects a lot of dogs. You've probably heard of bloat. If you haven't heard of its actual name, it's called GDV, which is gastric dilation volvulus complex. And it is a true medical and surgical emergency. When we talk about, how many dogs it's affecting, 30 to 60,000 dogs is the estimate of how many dogs are affected by bloat each year in the United States. To put that in perspective, it's roughly 5.7% of all dogs in existence in the country. Bloat is very serious. It has a 33% mortality rate if your dog, does have a significant bloat. And what happens is, as the stomach fills with air, pressure builds, and that stops the blood from the hind legs and abdomen from returning to the heart. While that's going on, blood pools at the back of the body, reducing the working blood volume and sending the dog into shock. If that wasn't bad enough, there's yet another scary thing that happens, and it's devastating to see. As bloat develops and gets worse and worse and worse, as the stomach flips, it can actually drag the spleen and pancreas along with it, and then now you're cutting off blood flow to both of those organs. So the oxygen-starved pancreas releases some very toxic hormones, one particular that targets the heart and just stops it as soon as it reaches it. So that's why if we recognize our dog bloating, we need to be very aggressive and very early on in the treatment. So before we get into the treatment, what causes it? One of the predetermining factors is your large, deep-chested dogs, your shepherds, your labs, and your bloodhounds. So unfortunately, basically every working dog that's commonly in use out there. Age, the older a dog gets, the more susceptible they are to bloat. How much stress they're under, the speed at which they eat, and their diet as well. We know, or if you don't know, a raw diet is pretty much the best thing you can do for your dog, but it's not really practical for our livelihoods and the way we like to operate. So what we can do as far as prevention goes is we can feed them in multiple smaller meals and then restrict their exercise for 2 hours. Or you can do a gastropexy, which is just a surgery that attaches the stomach to the abdominal wall. Now, I kind of laugh when I say, feed smaller amounts, restrict exercise for 2 hours, because I actually wrote an article for Police Canine magazine a couple of years ago and painted the picture with bloat in mind, to the fact of, we are creatures of habit. Usually you're working, you come home, you feed your dog or whatever your routine is. The problem lies in the fact of, the second you do that, you give your dog his meal, all of a sudden, boom, you get a call out and you're racing off to go deal with whatever, situation is going on. So it's not really, a strong expectation that, hey, I can guarantee that my dog won't have 2 hours of exercise after feeding him. So we can try to do it, but we also get to the fact of that's not our reality. So let's get into some of the signs and symptoms we would, expect to see if a dog is starting to bloat. So the signs and symptoms you should expect to see if your dog is starting to bloat is, number one, the dog will just be pacing around, just appear very uncomfortable and in distress for, an unknown origin. I always like to say or paint the picture, if anybody's ever said, calls you and says, hey man, I don't know what's going on, but the dog the dog's fucked up. I don't know what's going on. Right away, you should start kind of thinking, or at least doing your line of questioning on, could this be bloat, and start painting a picture to see if that's a possibility. You will also notice as bloat progresses that they will have a distended stomach. Obviously, it's filling with air. The dog will be trying to throw up, but they'll just have unproductive retching because they can't get anything out because that stomach has twisted and nothing can leave it. They'll start to develop difficulty breathing, again, because they're just building up pressure and putting pressure on everything within that chest cavity. They may assume a prayer position where basically the dog puts his paws down and his head down and kind of lifts his butt up because he's just trying to move air and get some relief any which way he can. They'll show signs of exhaustion. They may have an unsteady gait. They may be trying to lay down, but then they'll get right back up. And then finally, they will exhibit signs of shock. So in your dogs, one of the best things you can do to evaluate shock, you lift up their gums, find that, pigmentation where they're in their gum line, and usually probably, bright and pink. And in this case, again, because this is a circulatory issue, you're going to be seeing that pale gum color and, just signs of circulatory shock. So now we can get into the emergency treatment of this if it would have to be done to save the dog's life. All right, so we have our dog here. He was showing signs of bloating. We checked his gums. They were that pale color, so obviously we're having some sort of circulatory shock going on. On top of that, he seemed very lethargic, couldn't get comfortable, had an abnormal gait. We started suspecting bloat. We looked down from the top of the spine. We were looking for symmetry, and as we were going down, feeling and looking, we noticed there was distension of his stomach on the right side. So this is a bloat case, and we've decided that after checking his pulses and seeing other signs of shock, this dog is in severe decompensation and is basically going to die if we don't take immediate action. So what can we do for bloat? Well, first and foremost, we can keep this dog calm, warm, and level as best we can. We can immediately start an IV, just to give him fluid to support his perfusion. The cephalic vein would be our access point of choice. And from there, as far as our dosing goes, you're looking at 20 cc's per kilogram of a crystalloid solution, and then repeat that as necessary. After that, or even before that, depending on the situation, we can do the needle decompression of the stomach. So for this, we're basically going to auscultate the lateral abdominal wall, and while we're doing that, we're going to percuss with a finger. And what we're hoping to hear is a tympanic pinging noise, and basically the stomach is filled with air. That's what it's going to sound like. So once we get that, if it's feasible, you could clip and prep roughly 6-inch by 6-inch area at the point of where the loudest pinging was. After that, we're going to insert 14-gauge needle perpendicular through the skin of the abdominal wall and stomach. The needle that we are using is the one that is in our Ranch Strategies custom canine IFAC kit. And for that, we chose the Tytech Medical Pneumodart. The reason we chose this particular needle is obviously it's 14 gauge, 3.25 inch, everything you need for that. However, it's got a little system in here with a spring and a piece of plastic that you actually get an audible click when you do have air or gas release. And what we really liked about it is not so much for the bloat factor, but when you're decompressing a tension pneumo on a dog, if you have to, they have like a safety tip on here, and that comes into play significantly when you're decompressing a dog. But back to this, we've gone down, we've percussed, we've auscultated, we have the distension, we're finding this widest part of the abdominal area. The one thing we will caution on is you want to stay a little bit more proximal than distal, just to make sure you're avoiding the spleen and pancreas. So once that's happening, we've identified our spot. We take our 14-gauge catheter, we insert it perpendicular straight through the abdominal wall and into the stomach. Once that happens, you should get an escape of a foul odor and or fluid escaping, indicating proper placement. Once this happens, you can massage the area around it just to kind of help expedite the process of getting all that gas released. You remove your needle. Now, this dog 100% has to go to a vet and will still require surgery. All you've done is taking some of the air and relieved some of the pressure on the organs to buy this dog more time. So knowing that, the best thing you can do is during your transport, be ready to decompress for bloat again and again and again, however long it takes you to get to definitive care. Well, that's all I have for you today. I hope you liked it. Please give us a like, hit the subscribe button for more content. Also go to the websites, ranchstrategies.com or medicineandbadplaces.com. All of our upcoming training courses will be listed on there, or if you just need more info, shoot us an email. We'll see you next time.